Yes, welcome again. Some of these ailments. And today we have the privilege to discuss an infection and its risk factors that actually we sometimes do not know that we are at risk. So the risk factors for urinary tract infection. As we prepare to start off, kindly subscribe to this channel. At the end of it, give your comment so that we can continue to improve and continue even to give information that most of us will understand and be helpful in our lives. So, what are some of the risk factors for urinary tract infection? In short, UTI. Many of us have gone to medical facilities with some ailments or with some symptoms and signs, and your medical practitioner has actually diagnosed you to be suffering from a UTI, urinary tract infection. Sometimes you have taken through all the parameters of this infection, and sometimes not. And some of the preventive measures or some of the factors that we are supposed to be concerned with are risks, so that we can know how to handle the risks and avoid or prevent entering into this type of infection. Now, what are risks? These are things that make you more vulnerable to be attacked by a certain infection or ailment. Now, when we talk about risk factors for urinary tract infection, what are you talking about? So let's try to look at some of these risk factors. And I know we are not going to discuss many or all of them, but a few that we are going to discuss, actually, I know they're going to be of importance to our lives. Some of these risk factors are diverse, meaning they are to both male and female, and who are at most risk. Statistically, women are at more risk of acquiring these infections than men. Why is it so? The female factor involves many aspects of life. One is gender. The gender has a lot to play when it comes to certain types of infections. It's because when you talk about gender, and specifically talking about female or women, we mean the genetical makeup of a woman actually makes her to be vulnerable to many types of infections. And therefore, as women, we you need, or women, we need to be in agreement for continuous medical checkup and advice for us to avoid many of these risks. So one of them is the genetical makeup. That means in terms of how big you are, or how to be specific, those women or ladies who have bigger buttocks and tend to harmfully, I'm trying to be more general and avoiding some of the junk names or terminologies in this thing. So women who have bigger makeup, they're big in size, the buttocks also are big. When such women go to a long call, in most cases, they tend to wipe themselves towards the front, hence making more vulnerable to this type of infection. Remember, your anus and the vaginal area are extremely almost together. The distance between them has no significance, meaning They are almost tied together. So when you wipe towards the front, what are you doing? You are making your reproductive system more vulnerable to this type of infection. Why? Because within the stool, we have this bacteria that is called Escherichia coli. In most cases, this bacteria tends to localize within the feces. And when you are wiping towards the front, then you are making your vaginal area to be more vulnerable to being infected by this bacteria. And that's why we'll recommend that in most cases, you wipe towards the back to avoid this type of infection. Kindly. Secondly, having many sexual partners makes you more vulnerable. Remember, urinary tract infection is mainly acquired through contamination. For example, if you are sharing a toilet, you can acquire it through that contamination when you are going for these types of calls, whether it's a short call or a long call. Once you have acquired it from that type of contamination, you have a chance to infect your partner, with this type of infection, if actually you have been diagnosed to be suffering from it. And therefore, imagine you have the infection and then you have multiple sexual partners. You'll be going around infecting almost all of them or everyone that you meet. And therefore, if you have multiple sexual partners, then it puts you at more risk of acquiring this infection than any other person who do not. And actually, this is the main factor. And remember, once you acquire it from the contamination, we'll term it UTI, urinary tract infection. Once it starts spreading from one human being to another, it now changes to an STI, that is sexually transmitted infection. And this is where now it becomes more fatal because many people are at risk. And therefore, these risk factors, it is a factor that has to be considered in that we must avoid having many sexual partners. And today, as we are discussing this, I am seriously considering your attention so that when we finish this series, you'll be able also to teach or spread the gospel to many, many other people who are outside there, your friends, your relatives, and those who are closer to you. Even you personally, this is something that can help us change and avoid these type of infections. And when we consider these risk factors, then we are at a glance of minimizing the mortality rates. When I talk about mortality, I mean the rate of infection that we experience on a daily basis. So today, I will stop there, but I know you are going to take the action. And what we are talking about, it is not something that has any other thing at stake. It is our lives and the lives of those that we love most that are at stake. And therefore, when we start by ourselves, then we're going to spread it to even those that are closer to us. So that as we continue, we are going to have a healthy, lovely, and happy society for all of us. For all of us. Thank you very much for today. Next time, we're going to continue with this series of the risk factors. So kindly do not forget to subscribe so that you don't miss the next episode. Thank you and be blessed. Thank you.